Well, the so-called Patient Protection and Affordable Care Act. Leave it to the Democrats to come up with some. It's like S-chip, right? The S. It sounds like something you want to avoid in a cow patty. This one has PPACA as its acronym, right? If the Republicans had done this, it would be the Save Americans Health Act or something. They would have figured out a fancy way to do it. But anyhow, here's this bill bans exclusion for pre-existing conditions, bans annual lifetime caps, caps consumers' out-of-pocket expenses, allows people up to 26 years old, kids up to 26 years old to stay on their parents' programs, starts state exchanges, and if states decide to opt out, the federal government comes in and says it will provide an exchange. This is not the program I wanted. I wanted a national single-payer health care program. I wanted Medicare for all. But it's, I think, a hell of a lot better than what we have. Robert Moffat, on the other hand, from the Heritage Foundation, heritage.org. Robert is a senior fellow, domestic and economic policy studies at the Heritage Foundation and the Center for Health Policy Studies, an expert in this area. Would I be accurate to characterize it, Robert, as saying that you strongly disagree with me?
I think I had a strong disagreement with the Congress and you and Nancy Pelosi and Harry Reid and the president on this bill.
Okay, what I find particularly interesting, if I'm reading the article that you wrote, Obamacare is a threat to federalism, correctly, is that your argument against this legislation isn't what it does or doesn't do, but rather that you believe that it's unconstitutional.
Well, I think what it does, I do think it's unconstitutional, but I think what it does, it goes way beyond the issue of health care. And that's not just my opinion, actually. What you'll notice when you read the article in the first paragraph, I quote none other than Jonathan Turley at the George Washington University, who says this bill, in fact, would amount to a do not resuscitate order for federalism as we know it. It radically alters the relationship between the federal government and the states. My argument is, and I think that if you look at the language of the bill, my argument's pretty strong, that the states are basically reduced to vehicles of federal health policy, and I think that's a profound mistake.
Now, Jonathan Turley, I believe, I could be wrong, but I believe he was saying that when there was a debate back between Clinton and Obama, and Clinton was taking the position of a mandate, and the mandate was an actual mandate. I'm assuming that you realize that this thing that's referred to as a mandate is no more a mandate than my choice to rent and not take a tax deduction versus buy a house and take a tax deduction.
Yeah, well, the point is that what's the big change here is that Congress has done something that Congress has never done before, which is says in effect, you will buy a health insurance policy or you will pay some kind of a tax penalty or a fine. And Congress has never done that before. And my argument is it's great for the insurance companies. The insurance companies have Congress basically telling the rest of the population that they must buy their product or be subjected to some kind of a fine. The mandate, I
would say they've been doing this all along.
Pardon?
They've been doing this all along. Congress charges me and you and me an income tax, and they spend that money for a variety of things, including health care for people who don't have insurance.
That's correct.
Right
As
now,
a government program, under certain circumstances. Here, you have a universal mandate that applies to every human being in the United States to buy health insurance that they say you must buy.
No.
Based on their design of the health insurance.
No, I believe that, Robert Moffat, that you're mischaracterizing this. What they're saying is that if you choose not to buy health insurance, that's fine, no problem. You get to help pay the cost that the federal government is paying for the health care of people who are uninsured. And so you're going to be paying a couple $100 a year. It's going to cost a lot less than buying health insurance. But you have to pay that tax. And this is how the government, if you want to have a military, we all have to fund it. You want to have roads, we all have to fund it. On the other hand, if you buy health insurance, we'll give you a tax deduction. That's not a mandate, that's a tax deduction. Just like if I want to buy a house, I get a tax deduction.
The mandate is a mandate. The fact that
it's not a mandate.
The fact that, Tom, it is.
The word mandate does not even exist in the legislation.
No, they call it shared responsibility.
Tell me where in the legislation the word mandate occurs.
The word mandate does not occur. They say, in effect, every American must buy an acceptable level of health insurance, or if they do not, they will pay a penalty.
It does not say that in the legislation.
Well, I mean, Tom.
That language does not exist in the legislation, Robert Moffat.
They call it individual responsibility, then. Okay, that's what they call it. Which, by the way, is another abuse of language, because if you're going to exercise individual responsibility, that's something where you make an internal willful decision to do something, not under the duress of violating in effect, a federal law, or complying with what a federal government requirement is for buying health insurance. But, I'll tell you something, Tom. To be frank, I don't think it's going to work. I think what a lot of people will do is exactly what, in fact, you have suggested they will do. They'll look at the health insurance plans that are available to them, which are going to be much more expensive, and they'll make a decision. They're going to say, why should I buy the health insurance when I can pay a relatively modest fine, in effect? And what we may
tax.
end up
Let's call it a tax, because that's what it is.
Call it a tax, whatever you want to call it. And at the end of the day, we will end up with actually more people uninsured than perhaps today, after spending another $1 trillion.
Well, we may. On the other hand, because this legislation cranks down on some of the abuses of the industry and makes it easier for people to buy into health insurance policies. I know, for example, we've got a relatively small business here in Oregon, and it's just hell on wheels trying to find a small group policy. For any small business, it's almost impossible, and this is going to make it a whole lot easier. Unfortunately, it's going to be 3 years before it makes it a whole lot easier.
Well,
but I think that you're actually going to, you may well be right, and this is why I think that we should have simply reduced the eligibility age for Medicare to 0.
Oh well, I know you feel that way, Tom.
Why not?
Well, because frankly, that means in effect that everybody's going to have one type of plan, which is Medicare, and if you don't like it, that's tough.
Well, why not do it with Medicaid then and let the states administer?
Well, Medicaid's going to get a big expansion right now. We're talking about 18 million people, who many of whom thought they were going to go into private health insurance like their neighbors, are going to end up in Medicaid, which is probably the worst performing health care plan in the country.
Because it's one of the smallest, and when it has 18 million more people in it, those people are voters, and if they're not happy with the they're going to raise hell with their
they're going to raise hell. But the truth of the matter is that when it comes to cardiac care, cancer care, prenatal care, people on Medicaid do not do nearly as well as people in private health insurance. And the problem is with these folks is that the states are basically saying, in effect, you reach a certain or income level, you're going into Medicaid. You're not going to be able to
in
get
part
into
those negative outcomes, though, Robert Moffat, and I'm sure you're going to agree with me on this. In part, those negative outcomes from Medicaid are the consequence of the fact that most of the people on Medicaid are coming out of poverty to begin with, and people in poverty have poor medical outcomes in general. They have higher obesity rates, higher high blood pressure rates, hypertension, higher heart. The whole.
Some of that is true. Some of that is true. So a lot of it is because under Medicaid, physicians and doctors and hospitals and medical professionals are paid much lower rates than.
So you think a doctor who's paid less does a sloppy job?
I think what happens is when doctors are faced with Medicaid populations, and every time they provide medical care to a Medicaid person whose reimbursement for that person is less than the cost of delivering the care, what the doctors will do is they'll say, look, I'll take care of the Medicaid patients I have now, but I'm not going to take any more. So what actually happens is a lot of these people do not have access to primary care physicians. A lot of physicians won't take new Medicaid patients. And what happens to these people, these poor souls, is they end up going to the hospital emergency room.
No, you're right. And I think it's a shame and a crime.
It's
it's one of the reasons why we shouldn't have people going into medicine, because they think it's a great way to make $1 million. I spent an hour and a half on the phone last night with a friend of mine who's a healthcare provider up in Vermont, who is taking nothing but Medicaid patients and not making a huge living, but just getting by just fine.
Getting by.
And that's the person that I want as my doctor. I don't want as my doctor somebody who's trying to figure out how much they're, whether they're going to make $1 million or $1.5 million this year, and whether or not they can afford to buy that second house in Miami.
Tom, a lot of doctors are not making $1 million and $1.5 million. I mean, a lot of them are actually struggling, especially with medical malpractice costs, the cost of complying with government regulation, which is also adding transactional costs to them, and wrestling with private health insurance as well. It's a tough situation.
No, it is.
For a lot of doctors.
And Robert Moffat, heritage.org. At the one thing that we both agree on is that this is a very imperfect plan. Thank you for being with us.
Oh, it certainly is. Nice being with you, Tom.
Okay, good talking to you.